Hello everyone, my name is Jordan, and I am a licensed Medicare health and life insurance broker with Health Insurance Advisors Agency. Many people call me that are on a Medicare supplement and see their premium increasing significantly each year, and they are calling to ask me what other options are out there. So I wanted to create a video to explain the differences between a Medicare supplement and a Medicare Advantage plan, which is another Medicare plan choice. These plans do not work together, and you cannot have more than one of these at the same time. So first, let's talk about a Medicare supplement. Supplements are typically more expensive, but they usually have higher coverage amounts on the big medical conditions. So, you pay more each month, but if you use it, you will have less bills than if you went to the doctor for the same things on an Advantage plan. People usually love Medicare supplements that want little medical bills, have health problems, and are worried about what medical bills could be adding up, or just want the peace of mind to know that they have very comprehensive coverage on the big medical conditions. Medicare supplements don't give many bells and whistles. So for example, you do not get an annual physical. You get a less comprehensive wellness visit. Some preventative labs are not covered, and you don't get things like preventative vision, dental, or hearing. So when you add up what you're paying each month, and if you aren't going to the doctor very often, then some people start to think that the price of the plan isn't worth it. When you have a Medicare supplement and go to the doctor first bills Medicare and they bill your plan second. So Medicare pays their share if it is a Medicare approved service, the plan pays their share, and you are left with anything that did not get covered. A very important thing to note is that when you first go in Medicare Part B, you have a 6-month window where you can choose any Medicare supplement and you're guaranteed to be accepted onto that plan. So if you have been on Medicare more than 6 months and you want a Medicare supplement, you would have to pass a health questionnaire. They ask you if you have had any big medical conditions in the last 2 to 5 years typically, and if you say yes, then they may deny giving you a supplement. Most of our clients love the network of this plan. You can go anywhere Medicare is accepted. Most people that like to travel, have kids in different areas, or are snowbirds love these plans because they don't have to worry about staying in network. As long as the facility takes Medicare, then they will usually also take your supplement plan as well. Many supplements do not have drug coverage within them. So if you get a Medicare supplement, you would also want to get a Medicare drug plan. Now let's look at a Medicare Advantage plan. They are also known as Part C plans. These plans have a network, and you usually pay less if you remain in the network. If you get a Medicare Advantage plan, you would be getting your coverage from a private insurance company, and they will be administering your benefits and coverage rather than original Medicare. So it is convenient because you usually have one card rather than 3 on a Medicare supplement. Medicare Advantage plans can have very little premiums. The reason they can cost so little is because Medicare pays the insurance company you pick to take on your risk and administer your benefits. These plans have copays for most things you do in a medical facility. People usually like these plans if they want to save money each month on the premium and then are willing to pay some bills here and there as they use the plan. I think of this as a pay-as-you-use-it plan. These plans can also offer some bells and whistles like annual physicals, more blood work tests covered, dental, vision, hearing, or gym memberships. These are things not typically seen on a Medicare supplement. Another thing about Advantage plans is that the insides of the plan can change each year. Things like copays, max out-of-pocket, deductibles, and the bells and whistles of that plan. That is why you can change your Advantage plan each year if you want to without any health questions asked. Again, there is no one plan that is best for everyone. Everybody is different, and there are so many plans out there. This is great because different plans work better for different people, but can be overwhelming to make a choice on which one is best for you. I would recommend looking at things like your budget. Are you willing to pay more each month to have more of the big medical bills covered, but not the preventative bells and whistles? Are you the type of person that would want the comfort of knowing you have comprehensive coverage if you are admitted into the hospital? Do the thought of medical bills prevent you from going to the doctor? Well, then maybe we should look at a supplement. Or would you rather have a lower premium and are willing to pay some copays when you use medical services? Sometimes people tell me they would rather save money each month on the cost of the plan, and then they have more money left over if and when they do go to the doctor to get some things done. Convenience. Do you want to handle only one card, or are you willing to use 2 or 3? Networks. Are you okay to make sure you're using in-network providers, or do you want to be able to go anywhere Medicare is accepted and have freedom to travel and take the plan with you? Medicare supplements were the first type of Medicare plan, and most people chose them. But now Medicare Advantage has been offering more coverage every year. So now many people first enrolling are choosing Medicare Advantage over Supplement. When you look at how much you pay on a supplement versus how much you can pay on Advantage on the bills, there's no bad choice. Both choices are good. It just depends on you and your lifestyle. When picking a plan, your drugs can be one of the biggest factors. Most drugs plans have 5 or 6 tiers, and even though the specific drug you take can be a certain tier on one plan, they can be a totally different tier on another plan, even inside the same company. This can cause hundreds and even thousands of dollars in drug costs if you're not looking at this correctly. Another thing I want to remind you is of the Medicare Supplement window. If you go on a Medicare Advantage plan first, and then later decide you want a Medicare Supplement, you will probably have to answer a health questionnaire. And if you can't pass the questions, you may be denied getting on a Medicare Supplement. AEP is the annual enrollment period where you can change your Medicare drug or Advantage plan without health questions asked, but not a Medicare Supplement. You can actually change those any month, but if you want to change from one plan to the other or just change a part of your Medicare Supplements plan, you would still have to answer those health questions in order to change. Our main goal at Health Insurance Advisors is to help people and save them money. At Health Insurance Advisors, we work with all the top insurance companies, and we help our clients to find a company and plan to fit them. Just like there's no one plan type that is best for everyone, there's also no one company that is best for everyone. And we can help you find the plan and company that is best for you and your lifestyle. Again, we are paid by the companies that we are contracted with. So that means no cost for advice on helping you select a plan because the insurance companies pay us to help you. Thank you, and I hope to talk to you soon.